So it may seem like everyone you know is sick everywhere you turn.
So the CD is warning that respiratory illnesses are on the rise, including in the tri-state area. Here in the city, officials are seeing an uptick in emergency room visits. Joining us right now, New York City Health Commissioner Dr. Ashwin Vasan. What's going on? Nice to have you back. Happy New Year.
Happy New Year.
So what are you seeing in the emergency rooms?
Well, I mean, you're not imagining it. Cases are up for flu, cases are up for COVID. RSV, we think, has hit their peak and is coming down. What we want to say to New Yorkers, though, is it's not inevitable. It's not just like we're all going to get sick. There are steps we can take, right? Getting vaccinated for flu and COVID makes sense. Do it now if you haven't already. Wearing a mask in the subway in crowded settings will protect you from respiratory viruses.
Wearing masks.
I know it, but even if it's every now and again,
okay.
And especially if you're a high-risk person, if you're an older adult, if you have an immune system problem, a chronic illness, if you're around those people, stay home if you're sick, wash your hands often. We can ride this out. We know how to do this. We have tools. Get tested and treated early and often if you do feel sick for COVID. And we have all the tools in our arsenal to get through this winter safely, but it's not inevitable that you're just going to get sick and this is just happening to us. This is a part of living with COVID and living with this virus.
We both had the Rona at Thanksgiving. And thank goodness it was mild.
Glad you're better.
Yeah.
Glad you're better.
Can we talk about this nonstop cough that, I don't know, comes out of nowhere? People are talking about it all over social media. It's like one day and then it's gone and then it's back and
well, interestingly, when you get sick from a respiratory virus, whether it's flu or even an ordinary cold virus, your lungs get inflamed, right? So imagine you get cut and then your body heals and it forms scar tissue. Well, that's exactly what's happening to your lungs. It's forming scar tissue, it's healing, but in the process of healing it can be really sensitive and very twitchy. And that's what causes this long-term cough. Even though you don't have fever, even though you don't have muscle aches, even though you don't have no other symptoms, the cough can linger for weeks.
Let's talk about some of these COVID tests that we can go pick up at the store, because when I went to go see a doctor, I took a test and it showed me flu negative, COVID positive. Do you think they're going to be coming out with something like that soon so we can take an at-home test, we can tell if it's a flu or if it's COVID? Yeah,
rapid tests for flu are certainly being developed. Rapid tests.
But they have them in Europe.
They do, and so, you know, it's a process of FDA approval and dissemination and distribution of that.
And money.
And lots of things. But yes, so I think the getting through a respiratory virus season is going to be all about getting yourself tested early and often and making those smart decisions.
So I know you talk about get vaccinated, wear a mask, but what about other things that people can do? Because I feel like maybe we're not addressing the way we eat, how much we sleep. Are we hydrated? Are you talking about some of those things to prevent us from getting sick?
Absolutely. You know, at the end of last year, we launched Healthy NYC, which is our campaign to extend life expectancy in New York City. Yeah, respiratory viruses are a part of that, and preventing those is important. But it's about our diets. It's about preventing chronic illnesses. It's about taking care of our mental health. It's about, you know, reducing our reliance on substances like alcohol, and for people who are using illegal drugs, on those. So all of the above, we have to start focusing on our overall health to create that foundation to get us through any sort of health emergencies or new infections that come around. You're absolutely right.
Can we talk about the emergency rooms? Because a friend of mine who works in one emergency room said it's very, very busy right now with people who are sick, and they're overwhelmed with migrants. What do you know about the situation in emergency rooms in New York City? Well,
the emergency rooms are busy because respiratory viruses and seasonal illnesses are up, so that's very typical. We don't really know much about who demographics and documentation status and all that. That's not data we really collect. But yes, we're absolutely seeing busy emergency rooms across the city. But good news is that we're not seeing any of those overwhelmed to the point where we're seeing shortages or bed shortages. And we're seeing hospitals like Health and Hospitals and some other systems say you got to wear a mask in patient care settings. We're putting that mandate back inside patient care settings because we have a lot of sick people and we have a bunch of health workers that we need to be working to take care of us, right? And we can't afford to have them out sick for a week.
So I know you're not keeping an eye on who's coming to the emergency room, and you know that there's an uptick in, you know, all these other diseases. But we're also hearing that people who are taking Ozempic are having a lot of intestinal issues. Do you know anything about that?
Well, look, I mean, these are new drugs. There's a lot of promise in these drugs, particularly for people who are morbidly obese and who are at risk or have active metabolic issues like diabetes and heart disease and so forth. And that's really who should be discussing these medications with their doctors. I know that it's now a fad amongst celebrities and other things. That is not exactly who this is for, right? This is for really people who are sick. Number one. Number two, the decision to start these medications is really one that has to be made with your doctor. You know, this is not something where you should just be ordering online and getting it shipped to you without a real discussion about whether you're appropriate. And the last thing is, these are new drugs. So we're still learning a lot about their long-term side effects. We are not seeing some mass rash of sort of ER visits for these things, but when we do, these hospital systems report to the FDA, they report to the manufacturer, so that we can make sure that we're testing the long-term safety of these medications, which hold a lot of promise, but we still have a lot of learning to do.
I have a question, because I know you always tell us, you gotta get the booster, you gotta get the Pfizer shot, whatever shot it is. Travis Kelce reportedly made, what, $20 million with his endorsement in Pfizer shots? I mean, can you get some money? Because you've been saying it a whole lot.
Look, I would love to live in a world where when I said everyone should go get the updated vaccine, that everyone would listen. Because vaccines work and they've saved so many lives. The reasons why vaccination is the #1 reason why our life expectancy is as high as it is. 100 years ago, the average New Yorker lived 30 years shorter in terms of their life expectancy. They lived to about 45, 47. That's really quite remarkable when you think about it, and vaccination has been a big reason. So I would love to live in a world where I could just say that and people would believe it, but we live in a world that's a lot more complicated.
We live in a world where we believe a football star. I mean, they got to cut you a check or something, because it's...
I'm not interested in the money. I just want people to be safe and healthy, and that's my job as the city's doctor.
Look at you trying to broker a deal for him to get some money.
No deals.
Well, if Travis Kelce did it, you know, Dr. Vasan can do too.
No deals for me. Just go get boosted. Go get your updated vaccine. Stay healthy, New York.
And we just had the Rona. We don't need the vaccine now.
You do. You definitely do.
There you go.
Yeah.
You do.
What?
Well, because we know that infection-acquired immunity, right? The immunity that comes after infection is much shorter-lived. It's not unimportant, but it's much shorter-lived than what we get in terms of annual immunity from a vaccine.
Gotcha. All right.
Thank you, Dr.
Thank you.